colostrum in being what we consider to be one of the most researched nutritional supplements in the world. And that's quite a statement, with well over 5,000 clinical studies published on colostrum. So we want to get into the nuts and bolts of colostrum. This is what everybody's really waiting to see. And so if we were to describe what are the three major pathways that colostrum works in, well, first of all, when we say anti-infection, we must look at that in terms of antiviral, antibacterial, antifungal. So anti-infectious certainly packages all of it into one word. It's a great anti-inflammatory and a great antioxidant. So if we think about the three major pathways, those are the three. And I just thought at this point, two interesting facts, if I can just throw that up on the screen. The Ig antibody levels in colostrum are 100 times higher than levels in regular cow's milk. So, we must just remember that this is not cow's milk. We'll progress on to bovine colostrum and what it is in just a moment, but I just thought it would be interesting to see the antibody levels in colostrum and how high they are, compared to normal cow's milk. So there's a lot of comparisons actually in colostrum to things like cow's milk. So we must never get confused. They are two completely different things. And interestingly, bovine colostrum is one of the few non-hormonal performance-enhancing substances not banned by the Olympics Committee. And there is a few components in colostrum like the IGF-1 and 2 that are used by sportsmen to help improve their recovery and strength and performance, basically. And colostrum has these components in it. From here, we're going to move on to what I classify as the trilogy of colostrum. And for those doctors that don't know what products we're talking about in particular, I've brought these three up onto the screen. And right slap bang in the middle is our flagship product, which is the can, the Alpha Lipid Lifeline can, which is the powder. And to the left, you've got the Cell Works, which is a sublingual spray for under the tongue. It has the proline-rich polypeptides as its predominant component in it, which get absorbed under the tongue and straight into the bloodstream. And then to the right of that, we've got the Colostem, which is a range of botanical herbs that have been put together to help the body produce more stem cells. So these are three of the products, and then we move on to the colostrum caps in 60s and 120s. We've got the chews and the capsules, and we've also got the ImmuFort Ultra Boost colostrum, which is the high potency colostrum with added IgG. It also has the other antibodies, the A and the M, but it has a very, very high concentration of IgG, which, as you know, is the main antibody in the blood. So I wanted to also kick off at this stage by saying this is a very, very important part of colostrum, is not all colostrum is equal. And I see this, there is colostrum around. We see it in some of the shops, and I'm sure our members have also seen other colostrum around, and they don't really share much information about their colostrum. What's on the label, what's inside. So it's not all the same. It's a very, very important thing because we have insoluble colostrum on the left-hand side of the screen, and we have soluble powder particles, which is from New Image. It's a trademark of New Image where the particles are coated with a lipid layer to be able to bypass the harsh environment, the acid in the gut, and be delivered intact so that the body can use it efficiently. This is very, very important because if we can't get the colostrum to where it is needed, then it is generally not entirely a waste, but you want to get as maximum absorption of the colostrum into the body as possible. So I wanted to make sure that we understand the quality of colostrum we're getting from New Image is of the highest quality, and they've taken a lot of time to make it in a formulation that is easy to take in by the body and completely absorbed. So what's in it? It is really nature's powerhouse. It's the first food. When mammals, including humans, are born, the first food they receive is mother's colostrum, which is that thick yellowish fluid. Before mother's milk actually kicks in, the very first food they get is the colostrum, and that's loaded with all the immune tonics and the growth factors, and also a unique balance of vitamins and minerals. So just popped up on the bottom of the screen, you'll see the range of ingredients. It's got a marginal amount of dextrose in it, and it's got added vitamins and minerals, and the complex milk lipid trademark, the complex milk lipids there you'll see, that's what we're talking about. That is the trademark of New Image, to be able to make sure that this colostrum is delivered intact into the gut. So what are the active ingredients? We're looking at 1,000, this, and I'm talking about the can here, by the way. This is the product that we're referring to, is 1,680 milligrams of bovine colostrum from the cow, and the total antibodies is 300 milligram and 45 milligrams of the alpha lipid trademark. Don't forget that it also has the added probiotics. We've got two of the main probiotics added into the colostrum, and at the time of MF, which is your manufacturing date, there are 1 million CFUs of the probiotics. So we have a decent amount of probiotics added to the can. This is not incidentally in the capsules or the chews. This is predominantly added into the can. So the next screen that I'm going to bring up here is really around the range of benefits. And if we look at the areas that doctors could look at colostrum to be able to prescribe a colostrum, just look at the diversity of the product. And if we look to the right of the screen, and we look in particular at the bacterial and parasitic infections and viral infections and fungal infections, apart from autoimmune and the metabolic disorders, if we just think about our COVID-19 patients and people struggling with viral infections these days, we have a product that gives you immediate transfer of immunity and strengthens your immune system straight away. So, Steve, what are your thoughts on this? Because I don't know of any other product that can deliver what colostrum delivers as far as treating viral infections these days. And let's not beat around the bush. We're talking about the COVID-19 pandemic, which has been devastating, and we see the figures starting to climb again. And this should be a product that should be aimed and making sure that doctors really understand how powerful this is. What are your thoughts there, Steve?
Yes, well, absolutely. I mean, this is what makes me very excited about the product. And I've used the alpha lipid colostrum powder for multiple different disorders. Quite frankly, it's an all-in-one. In other words, if you were to single out one product that would give you most of the nutritional requirements for the cell, regardless of the disease condition, I couldn't think of a better product than the colostrum. If one considers that colostrum contains everything from vitamins, minerals, amino acids, peptides, more than 80 immune enhancing agents, more than 80 growth enhancing agents, and then it's fortified with a bit of extra nutrition and the probiotics, lactobacillus. It's an extremely useful tool to add to your armamentarium of treatment protocols when you want something that's going to deliver something of everything from a medical or nutritional biochemistry point of view. So let's use an example. A patient comes in and they have, for example, an allergic condition, or they have inflammatory condition, arthritis, rheumatoid arthritis, or autoimmune condition, or they have cancer, or they have ulcerative colitis, or they have Helicobacter pylori infection of the stomach causing the stomach ulcer. The virtually is no disease that you cannot use colostrum for in some sort of beneficial way to either modulate the immune system. Modulation is the important aspect because we speak about always immune boosting, but to be more technically correct, immune system enhancement is where one has a suppressed or severely compromised immune system. For example, in HIV or malnutrition. But you also have conditions where the immune system is overactive and you wouldn't want to enhance it. For example, in autoimmune thyroiditis or any one of the autoimmune processes where the body is attacking itself, multiple sclerosis, for example, ulcerative colitis, rheumatoid arthritis. So there one would want to tone it down. And this is the big advantage from an immune system point of view with the colostrum. It modulates. It has an adaptogenic effect. In other words, it'll adjust the body to where it's meant to be. So if it's too high, it'll bring it down. Too low, it'll bring it up. And it'll help to maintain the body with those various immune-enhancing factors and immunoglobulins. So from an immune system point of view, an inflammatory system point of view, it'll reduce the inflammation, modulate the immune system. But now if we're speaking about from for example, a person that is suffering from cancer and there's wasting and there's a weak immune system, one wants to achieve three things. One wants to kill the cancer cells. Number two, one wants to maintain the person's health. And number three, one wants to prevent them from wasting, literally wasting to death. And this is where colostrum once again plays an important role. By getting them onto the right diet, eating correctly, drinking correctly, avoiding toxic elements, taking colostrum, they're going to build up the immune system and their hemoglobin levels. Hemoglobin is another big problem. The cancer patients become anemic. Their hemoglobin drops. They are not able to carry enough oxygen to their cells and the brain. They become very weak. The body becomes fatigued. The colostrum is able to enhance the red cell blood production. And in fact, it enhances stem cell production, which you just touched on with one of the other products as well. That is a huge advantage. Once again, it's regulated, not out of control. So it has multiple benefits. And even for the, as you also just mentioned in your slide there, bodybuilding and sports performance. It is a very good aid to sports performance and to enhance muscle growth with sportsmen and women, Ironman, or whether they're power lifters. My business partner down in Durban, your part of the world, he's an ex-2 world record holder in powerlifting. And Dr. Alex Seaton has made colostrum and nutritional supplements part of his protocol for years and years with obvious results. It works. And just the last touch and there on the antibacterial, antimicrobial, antiviral effect. This is another big advantage. We all know that infections play a huge role in disease and killing and maiming multiple millions of people per annum worldwide. And antibiotics, they have a tremendously important role to play with respect to certain disease entities where you need to hone in specifically, use a targeted antibiotic to treat them. But on the other hand, there are also many infections that there aren't specific antibiotics for. And here we need the immune system, the body's own innate immune system to kill the virus. And this is where the alpha lipid colostrum plays such an important role in enhancing the body's ability to kill the viruses, bacteria, parasites, fungi, molds, etc., by enhancing the various immune factors, immunoglobulins, leukotrienes, lymphokines, etc. And we must bear in mind the side effects of multiple antibiotic use. You develop multi-drug resistance.
Absolutely.
Side effects. Yes, so an excellent all-rounder. It would be the one that I would take with me if I could only take one product.
Thanks for that, Steve. I think it's quite important, to hone in on, I would almost call it shotgun therapy. You have broad spectrum antibiotics, but this is nature's broad spectrum. And, we were talking about all the different types of viral pathogens and in particular, the bacterial and parasitic infections in the body, and how many studies that I've seen showing how effective colostrum is against these viruses. So we must never underestimate this. I agree too with I think the prescription of antibiotics has become kind of the doctor's quick way out, if I can put it that way, and we know that a lot of these parasites are very, very particular, and to be able to identify exactly what you have and prescribe an appropriate antibiotic, whether it's gram-negative or gram-positive, and make sure that you've got the correct antibiotic for that. And this is also where colostrum starts to support those, because we're starting to put the goodness back into the body, especially those good bacteria that we get from the colostrum, to try and rebalance the gut.
Correct.
Because that the antibiotics just end up stripping out half the time. So if you have to prescribe an antibiotic, this is a great product to add to it, because it certainly gets the goodness back into the body and stabilizes the gut. And we're going to be moving on from here just a little bit more, talking about more general what bovine colostrum does. And Steve, you mentioned it right now. It's a great immune system modulator and also cell recalibrator. We spoke about its capacity in exercise to improve exercise performance and recovery. I did mention that just now. And enhancing stem cell activity for healing and regenerative processes. And here we go again. If you look right down at the bottom of the slide, you'll see by Dr. G. Sisolak. Now, some of these slides, I kept the presentation from Dr. Gerhard Sisolak over a year ago, because he had some very, very important aspects of his slides that he put together. And, looking at the risk of septic shock and treating deep wounds. I mean, who would have thought you could use colostrum for treating deep wounds? And he had very good success by putting colostrum onto a wound and getting exceptionally fast recovery rate of a wound, where the wounds were going septic and the bacteria weren't able to survive in the wound, by adding the colostrum. So it kept the wound clean and it enhanced the recovery rate. So for me, that was something else that I thought, wow, in a hospital setting, we should be considering using colostrum in a place like this.
Absolutely.
So
and sorry to interrupt, but just to add to what you said, in a hospital or practice situation, one must remember that colostrum can be used as an adjunct to whatever treatment you're doing. Yes. So whether you're using antibiotics or using anti-inflammatories or analgesics, or you're encouraging the people to eat well or exercise or whatever, or you're using topical agents for wounds or whatever, the colostrum is a wonderful adjunct. You can't go wrong using it. And I think that's another important factor.
Correct. And looking at UTI infections and diarrhea, Steve, I can tell you in my own experience, and also chatting to the members of New Image and those people that have had diarrhea, chronic diarrhea it's debilitating. Yes. And for a number of reasons. And if you have diarrhea, my advice would be to use your colostrum and don't be shy. Take 2 or 3 doses a day with your colostrum, and you will get very, very fast recovery from your diarrhea. I remember having it, and in fact, I think it was from a particular food that I ate, fish, at one stage, and I think it was off, and it really hammered my gut, and I had chronic diarrhea, and I think within a few hours it had actually started. When I say chronic, at the time that I'd started to use colostrum, it helped it very, very quickly. So we're also going to move into, in a moment, we're going to be talking about the impact of colostrum in the gut. And I know that we speak a lot about gut health, and essentially this is your pot where all the inflammation starts. And a raw and inflamed gut can lead to all sorts of inflammatory conditions. So by adding the gut flora, adding the probiotics from the colostrum back into the gut, and try to modulate and settle those flames down, from inflammatory conditions. We know the cascade, Steve, of how far inflammatory conditions can stretch. And it really has an enormous impact on people's health. And of course, Alzheimer's and MS. So metabolic disorders, we know colostrum has been very, very instrumental in a lot of people recovering from this, particularly type 2. And I didn't realize, the amount of people walking around undiagnosed as type 2 diabetics is around about 70 to 80% don't even know that they have type 2 diabetes. It is becoming an epidemic. And then to see how amazingly well they do on colostrum, reducing their glucose levels considerably in the body. And in some cases, we've had great testimonials from some of our members where they've actually come off insulin. So it's had an amazing impact on how it's been able to get the beta cells in the pancreas to start changing and kick-starting the beta cells again, and getting those cells to produce insulin. When you look at things like this, Steve, it almost says that medicine said once you're on insulin, you're on it for the rest of your life. And want us to just look at this and say, well, we seem to be proving that theory wrong, aren't we?
And I think that's a very important point you brought up there. Millions of people have been condemned to the fact that they have been told that they, once they have diabetes, that they will never be able to return to normal without taking their medication. And I think we just have to distinguish between the two. Type 1 diabetes is much more difficult to convert a patient to. But we are seeing success cases with that around the world as well.
Yes.
I have personally done it myself, and there's a number of other physicians around the world who have done it, have achieved it. And it doesn't mean in every case it's doable, but in many cases it might well be doable if the doctor has the tools and the knowledge of what to do to help that person, as you say, to reactivate the beta cells and to reduce the inflammation in the pancreatic cells, and also to look at the aspect of infectious agents as a possible cause as well. Yes. And this is something we can touch on later with respect to the so-called and the autoimmune diseases and the causative agents. From type 2 to get a patient back to normal, that is quite achievable. In fact, with the right regimen and protocols, within 12 weeks, you can achieve that in most patients if they stick to the protocol, of which colostrum plays a key role as well.
It certainly does play a key role, and I think it's important to mention as well that there's a lot of other factors that need to come into play when one is treating diabetes in type 2. You can't really rely on one product to do all the work. you got to realize the severity of the disease, because there's a history of if you have type 2 or type 1, you are more open to all sorts of other autoimmune disorders, and particularly cardiovascular problems later on down the line. As you know, Steve, it leads from one to another. So it's important to recognize that if you are a candidate and you have, been diagnosed as a type 2, that is very, very treatable, because you certainly don't want to move into a type 1 category.
Correct.
It's not rocket science to sort out. It's highly, highly achievable.
Yes.
Through good diet and changing your lifestyle.
Correct.
And this is where the consciousness of people, you need to wake up, because it can go south very, very quickly.
Correct.
So
yeah.
Let's just move on a little bit more here. We want to talk about the leaky gut syndrome, IBS and IBD, ulcerative colitis, Crohn's disease, and this is really the seat of how colostrum is so amazing. And I'll go into a little bit about leaky gut in just a moment, but you'll see they're also very beneficial in reducing drug-induced gut damage. So, Steve, I'm sure you've seen patients over the years that have been living on anti-inflammatories. The amount of damage that it does to the gut over the years, maybe a comment from you at this point would be great, because you see it.
Yes. Okay. This two very important points there. So, leaky gut syndrome is not really a term recognized by the conventional medical industry. My colleagues tend to not speak about leaky gut syndrome. They speak more specifically about IBS and IBD, which IBS stands for inflammatory bowel syndrome, and IBS, inflammatory bowel disorders. The important aspect is that it doesn't matter what terminology you use. At the end of the day, there's an inflammatory process. There's damage to the lining of the gut. And this results in either ulceration, or it results in the gut lining becoming permeable. And when it becomes permeable, it allows substances into the bloodstream from the gut that should not be going into that bloodstream. For example, certain bacteria, viruses, gluten, which is a protein, as you know, found in wheat, other foreign proteins, and other toxic agents. Once they enter into the bloodstream, they travel around the body. It takes approximately about 60 seconds for your blood to travel throughout your whole body. And it induces an immune response, an inflammatory immune response, and that can actually manifest in inflammation from the brain all the way through to the thyroid, to the lungs, to the heart, to the gut, to the muscles, the joints, the circulatory system. So one single episode, or let's say one single problem, in other words, permeability, increased permeability of the gut lining, results in multiple disorders, even sinusitis, for example, and increased allergies and sensitivities to other chemicals. So this is where, once again, colostrum plays such an important role. It reduces that inflammatory response, helps to heal the gut, together with L-glutamine, and it helps to modulate the immune system.
Yes.
So it plays an immensely important role there, together with other key factors. And then just to mention, as you said, and the damage of NSAIDs, which stands for non-steroidal anti-inflammatory drugs. You get mostly the NSAIDs, like people know worldwide, the Voltarens and the ibuprofens, for example. And then there's the steroids, the cortisone, for example. These also cause localized damage to the blood vessels and the gut, and other tissues and organs. We're not saying they don't have a place. Absolutely, they have a place when used correctly and for the right length of time in the right dose. However, excessive long-term use has enormous side effects. For example, bleeding, and this is it can be critical and fatal. So once again, we want to repair the gut and we want to reduce the inflammation in the body as much as possible and reduce our reliance on pharmacological agents.
Yes. Thanks for that, Steve. A great explanation of the importance of the gut. And you're so right about leaky gut. You just don't really hear it too much discussed in the medical world. You know, you do hear about more the IBS syndromes. So certainly, colostrum playing a huge role in its capacity to heal and seal the gut and reduce inflammation, and certainly assist in you were talking about allergic reactions, and from leaky gut, when all those foreign particles pass into the bloodstream and start setting up a cascade of autoimmune disorders, then you've got a bigger fire to start fighting.
Right. Absolutely.
So also just to mention here as well, the influenza episodes, it can certainly lower or reduce the time that you may have influenza. So, patients are experiencing a much faster recovery rate on colostrum. There are studies showing that clearly. So this is not just what we are thinking and what we are saying. We have good studies actually showing the recovery rate of people that have had flu and how quick they get through using colostrum. This was just a slide from Dr. Sisalat showing the colostrum used on a dressing. And after 15 days, you can start to see the wound clearing up quite quickly. So I just wanted to mention that. So if there are medical people watching that, this might just be another opportunity. We did mention deep wounds a bit earlier, but the slide just follows to that. So what else is in colostrum to strengthen the immune system? So we have a number of important components of the colostrum, as you can see. So you've got a list of the antibodies, and the range of all of them actually on the left-hand top side of the screen. You've got your PRPs and peptides, and certainly glutathione, as we know, is the master antioxidant. It will improve and increase the levels of glutathione in the body. You've got 80+ growth factors, the cytokines, the interleukins, and all the vitamins and other essential nutrients. I don't really want to run through each one of them, but at a glance, you can see it's got a fairly good spread of all the vitamins and essential nutrients, and certainly lactoferrin and the two probiotics at the bottom, lactobacillus and bifidobacterium. Those are your two probiotics added to the colostrum can. So that's just an overview of the components in it. And of course, a big slide talking about inflammation being the root of most disease. And if we look at the leaky gut issue on the next slide, we can certainly see how this stretches throughout the body.
Hi, Dr.
To really affect.
Hi, Dr. Anthony.
Yo.
I'm so sorry to just budge in. We've got Dr. Sashin on the line, but he's got an appointment. We just wanted to quickly do a testimonial with him. He's just joined our business yesterday. Also used the colostrum and recovered from autoimmune, I think. So I just want to let him do his testimonial very quickly to the audience that are online. And then if we can continue again with you, that'll be very quick. So if I could just ask Dr. Sashin, if you're there, to just turn on your audio, please. And then if I can just be joined by Mr. Chris Perry, who just do a very quick interview with Dr. Sashin. So Dr. Sashin, if you're there, if you can turn on your audio.
Hi, Vinesh, and thank you for the introduction.
Hi there, Doc. Welcome to the family. Welcome to the family. And I'll leave Chris with you. Chris, if you can just switch on your audio, and Dr. Sashin's on the line.
Yes, well, Dr. Sasson, I met him for the first time yesterday when he joined the company. He's had such a fantastic result on the colostrum, and I thought it was coming from a medical standpoint, backing you guys up today, the two other doctors on the call here today. I thought it would be a fantastic addition to listening to a new medical person that's just joined us and hear this wonderful testimonial. I was so pleased to hear it yesterday. So, Doc, if you would go ahead, that would be great.
Yeah, so quickly, just to tell you, in about my fourth year of medical school, I started suffering from sacroiliitis, which is the hallmark of ankylosing spondylitis, which is an autoimmune disease. So this was about 7 years ago. I was actually diagnosed about 4 years ago clinically. And since then, I've been on biologics, prednisone, all the anti-inflammatories and analgesia you can mention. And I started colostrum about a month and a half ago. And I took the colostrum with the alpha lipid capsules and the omega capsules as well. And I can honestly say from the second day I was asymptomatic, which means there was no pain, fatigue, and stiffness in the sacroiliac joints. The sacroiliac joints is actually your hip joints for those who don't understand. To be asymptomatic for the last 6 weeks has really changed my life. I can honestly say so. This works. It works. It works almost immediately. I have all the faith and confidence in this product. And just going through the medical information, clinically speaking, it supports clinically what it does and what it claims to do. It does it. It works. And I've tried every form of treatment: allopathic, homeopathic, and nutraceuticals, Ayurvedic, and nothing has given such a relief and benefit from the colostrum treatment. So thank you.
Fantastic, Dr. Sash. Yes, that's such a wonderful story, and I'm sure that the listeners on the call here today got a lot out of that testimonial. So we look forward to hearing much more about your developments as we work through the next few months with us, the new image here. So, okay, thanks for sharing that. We really do appreciate your time, and we'll let you go off to your appointment now. Thanks a lot.
Thank you. Thank you.
Good on you. Hand it back to you, Ant. Thanks.
Thanks, Chris. Thank you so much. Well, I must tell you, I'm really encouraged to hear, Stephen, I think you as well, you know, this is what we're looking for. We really want to hear the doctors that become their own patients and treat themselves.
Yeah, physician
and actually have success with the product and want to share the information, because I think what better way to go, you know, when you start on yourself, to trust a product and use it yourself and use it on your family, as I have, Stephen, so have you.
Absolutely.
You know, and had the experience of using colostrum in our families, ourselves, and then recommending it to our friends makes all the difference, because it's not always easy just to recommend a product that you've never used yourself and you don't know anything about.
Correct.
So, you know, although these slides that we put up explain the details about it, I don't think it can compare to the usage of the product and experiencing what we're saying. This is technical information sometimes for a lot of people. But you need to be able to see this, because when you start from an academic perspective, when you start to see what the product does, you then understand how it works in the human body. And this is something I've always been excited to share, and I hope it comes across in a way to our people viewing here, that the academic information is absolutely vital. We love to hear testimonials from people who experience the benefit of the product. But when you learn about the intricacies about how it works, certainly how I enjoy learning about it, when I add up the information together, it gives me more confidence because I see how big the information is around the world. You know, this is not just one or two trials from the company itself. This is about a product that is spoken about all over the world. So let's move on a little bit from here. We're coming to a close now because I think we are certainly closing in on our hour. And just to mention a few important points, so lactoferrin, that is one of the components in colostrum. It's a protein that's found in both cows and human milk. It certainly plays an important role in the innate immune system. It's an antibacterial, antifungal, antiviral, very, very strong component in colostrum. Great for iron homeostasis and a great anti-inflammatory and anti-tumor activity as well. And we're going to jump into PRPs because that's also another great component of colostrum. What are they? They're a small chain of amino acids, having a very powerful effect on balancing your immune responses. I don't want to read through this. We can certainly share the slideshow with everybody, but I'm really just trying to get across the value of a PRP or a proline-rich polypeptide and its impact on the immune system. Right, so the leukocytes, part of the white blood cells in the immune system. There's a lot of information online about PRPs and what they do. And we can certainly expand on that at another time. So what do we need to restore insulin production? This is a little bit more about the diabetes. And I'm picking 3 products here quickly, which is the CAN, the alpha lipid CAN, the cell works in the middle, and the colostrum at the body, and just showing a brief amount of information about the IGF, which is part of colostrum, and helping to regulate glucose in the cells and building new cells, and also restore damaged cells like pancreas cells and the beta cells. The cell works that contains the proline-rich polypeptides, contains great communication proteins. These are the PRPs, by the way, and they bring intelligence into the immune system to stop the attack on the beta cells in the pancreas that cause type 1 diabetes. And the colostrum is a product, as I said, which is made up of the botanicals, the herbal botanicals. So it's all natural components that help produce an increased stem cell production. We have the studies to show that as well, so that it's very, very important. And boy, oh boy, life doesn't happen without stem cells, does it, Steve? And if we can improve stem cells, or the production of stem cells, we have a gem, I think. So stem cells, very, very important here as part of your arsenal to use these 3 products as the trilogy. So this is just a bit of information very briefly about the ability of colostrum to reduce glucose, cholesterol, triglycerides, and ketone levels in type 2 diabetics. You can see the results here. This is from a trial at 2 hours and 8 hours after the meal, postprandial, decreased continually, and the cholesterol and triglyceride levels decreased significantly after 4 weeks. So a very, very important part of colostrum to also look at cholesterol and triglyceride levels, Steve, and not just the blood glucose.
Absolutely. Just one point there, and one of the listeners mentioned that you might get a slight elevation in the sugar with the powder initially. So they suggested that taking the capsules might be a way to go, and then introduce the powder later, or stay on the capsules. So perhaps you could just speak about that a moment.
Sure. I think that's important, Steve. I maybe wanted to consider reserving that for our focus on diabetes when we get to the PowerPoint slides, because that's a very, very important thing. And viewers, please forgive us. I don't want to take too much time on that right now, but Steve, what you've mentioned is a very, very important topic, and the correct dosage and introducing colostrum into the regime of treatment with insulin. I know that sometimes the sugar levels go all over the place. Yeah. And we found that we introduced a small amount of colostrum using the tablets or the capsules, first of all, in a much smaller dose, and then titrating the dose a bit more after week 1 and a bit more after week 2, because you'll start to see the levels stabilize. So we can get into the specifics about that when we talk about focusing on diabetes, because it's a very, very important topic, and being able to keep that blood sugar controlled while you are introducing colostrum is critical. Sometimes the patients get quite scared because they see the blood sugar levels. Now, that's a very, very positive sign for me, because it shows that something's working. So the worry is not, we don't want to see the blood sugar levels go all over the place, but it seems to be quite a typical result of once you start with the colostrum, people experience very similar things of the blood sugar going all over the place, but it does stabilize and it does start to calm down, but we start with small doses. So we'll get into the correct prescription of what sort of doses are going to work for you. So we need to be more careful with what we're using and how we're using it and how long. So a good question there, Stephen. Thanks for that. But we're certainly going to be dedicating a lot more time when we focus our discussion just on diabetes. So this is really around flu, showing how effective the colostrum has been for flu. And I did speak about that a little bit earlier. And these are just some of our doctors. In fact, I think this is probably an older slide, Steve. I think we need to bring some of our newer doctors onto the screen. So
maybe Dr. Session would like to come on as well. Yeah.
I think our database is growing around the country, So Stephen, in closing off, is there anything in particular you would like to add at this point, to your experience? Where do you find where you use colostrum in your practice mostly, and maybe just share that with our viewers?
Yes, thanks. And I'd like to mention two things. The one is, number one, if colostrum was patentable, it would be regarded as a medicine. Now this is quite a huge statement that I'm making, but if you think about it, in medical and pharmaceutical in the industry, a product, a medicinal agent, it has to satisfy a few criteria. It has to be safe, number one. It has to be proven to be efficacious, to be effective in what it's supposed to do. And number three, it's supposed to have quality control. And a bonus would be obviously some of the other nuances, for example, in enhanced bioavailability and the transport system into the body. Now, from that point of view, colostrum would actually qualify and tick all the boxes. It is safe, without a doubt. A mother's milk has to be the safest substance on earth. Without it, no one would be alive, except in the more modern era where we're able to take supplemental milk powder agents, but breastfed is still best. And so from that point of view, safety, number one, it qualifies. Number two, from an efficacy point of view, well, quite frankly, it would fit into the category of satisfying multiple pharmaceutical efficacy criteria, because it covers so many different medical disorders. So instead of where normal pharmacology and the pharmaceuticals are aimed at single remedy treatment. In other words, it's known as mono as opposed to polypharmacy. One problem, one medication. That's normally the norm, except for off-label treatment. But natural agents, for example, herbal or in this case, colostrum, it is polypharmacy. It is multiple agents that are beneficial. It is so loaded with good ingredients. I use it for everything. Quite frankly, I use it for everything across the board, from asthma to allergies to diabetes, arthritis, ulcerative colitis, cancer in a big way is part of my regimen. I've treated thousands of cancer patients, as you know, and from all over South Africa, Africa, and internationally, and it plays a key role. So right through to the end, as I said, to the Zs, to the zoonosis, and we haven't really touched on that. We can do that, Chris, in another training episode where we can discuss bacteria, viruses, parasites, molds, fungi, etc., what roles they play in a number of the diseases, and where colostrum can help. So, and yes, my passing shot is that we use it for multiple conditions, but very big when it comes to nutrition, wasting, cancer, immune modulation, inflammatory conditions, without a doubt.
Yeah. Thanks for that, Steve. And I see there's a few comments on the screen here as well, and people asking questions. And I would love to have the time to be able to assist them as well. But I think we are running short of time, and I think Chris has popped on the screen to probably tell us to quieten down now. We've said enough. Chris and Steve, thank you so much. I really appreciate the time that we've had together. And if you don't know now, you might as well understand that when Steve and I get going, this can go on for hours. We've really had a history over the years. When we get hold of a topic, we can rattle it around for hours and hours, and we just enjoy the process. So inevitably, it's gathering the information that helps people. So I hope you guys have really enjoyed this talk, and I hope we were able to expand the information on colostrum. And I'd like to thank Dr. Gunn for his input. Steve, thank you so much for your time and joining us today. And Chris, thank you for hosting such a great show. We're honored to be here. Thank you.
Thank you, Chris.
Well, thanks a lot, doctors. Certainly, we're very honoured to have you guys participating as well, and we really do appreciate your time. I see that Dr. Gunn's still in the scrubs there, so I don't know what he's been up to, but there we go. That's good to have you. Yes, there we go. But, you know, maybe next time, I see there's 2 or 3 questions there. The people that put those questions up, if you send them to SAF support, that's our local office helpline, we can get them answered. But just we're running out of time now, unfortunately. But maybe next time, docs, if we could have maybe 10 minutes or so with Q&A at the end of the session, that might be helpful to help people get their questions answered online. Hey, listen, it's been a fantastic call. We once again really do appreciate your knowledge and your excitement about the colostrum, and we've got lots more to share. We're just about to hopefully sign off a partnership arrangement or a coalition with I don't know whether coalition's a good word to use these days, but a partnership with the Diabetic Association of South Africa. Hopefully we'll pull that off in the next few weeks, and we can and Ants and Dr. Stefan Skuman have put together some fantastic slides to go into that market with. So and everyone will be invited onto those calls as well as we conduct them around South Africa. So once again, have a good afternoon, guys, and we really do once again appreciate your time. Thanks a lot, everyone, for being on the call. It's great to have you participating. We're all learning, and it's such an exciting time to be learning all this information about our wonderful product from New Zealand, colostrum. And last thing is, go the Boks. I see they've just about started their game, huh? The Springboks are playing the Poms now. All right, so good on you. All the best, and we'll catch you sometime in the very near future. Thanks a lot. Cheers.
Thanks,
Chris. Thank you.
Thank you.